So we're ready now to do some pelvic floor massage. And I like to do a global release of the exterior pelvic floor muscles. And I've got a couple options here for you. So on a 0 to 10 scale, we don't want it to be more than about a 4 or so, because then the body tightens and protects, which is what it's supposed to do. So on that 0 to 10 scale, that's your reference point, no more than 4. This is a hand towel. It's folded lengthways and then rolled up, and a couple of pieces of tape around it. And so it makes a little pad like that. And for phase 1, depending on how this goes, we'll start in a chair. You're going to put this underneath your pelvic floor, and you're just going to sit on it and kind of explore a little bit, maybe even a little bit of a pelvic tilt back, a little forward, a little side to side. And if this is painful, you can unweight yourself a little bit like so. And essentially, a couple 3 to 5 minutes on this to globally release the pelvic floor. I do find that my very narrow-hipped patients don't do too well with this because their sitting bones are so close together that this is just pushing on their sitting bones and it's not really doing much for their muscles. But some people do feel a little discomfort with this. And especially, you want to go back a little bit, like you're pushing towards the rectal area because part of the pelvic floor goes into that area. So just see how that feels back and forth. And I would have my patients stay on this, 3 to 5 minutes, maybe 3 or 4 times a week to do a global release. If this doesn't feel like much of anything, which it kind of doesn't feel to me, but it might to you, that's your phase 1 of the pelvic floor massage. If this feels like a whole lot of nothing other than pressure, you're going to transition down to the floor, and we'll try the same thing. So put it underneath the pelvic floor. You can sit cross-legged. Again, you're going to go explore kind of forward and back, side to side. See how that feels. Pressure is a normal feeling, pain is not. If it feels painful, let this be your go-to. You can try the Pilates ball. It's kind of comfortable more than anything. I don't know that it's super effective to release the pelvic floor, but it's kind of an option for you. So again, kind of explore side to side. But here's the deal. My goal, as unconventional as this looks, is to get you on a football. And I have experimented with every different kind of ball you can imagine, and this is my go-to. This is probably about maybe 60% inflated. As you can see, it's collapsing. You don't want it too hard, but the pelvic floor fits very nicely right there. So I'm going to take it. I'm going to put it underneath my tips or my tush like that, and now feels a little different than all those other things, but it's a really nice global release of the pelvic floor. And so again, you can explore forward and back a little bit. If you need to, you can get yourself a couple yoga blocks to give yourself some hand support. So just rock back and forth, maybe even do some circles. One way, circles another way, side to side. So the football pelvic floor massage is what I use before I have patients use the wand, then the dilator. So my progression is the football, maybe a little stretching, breathing, the wand, and then the dilators. So this is sort of phase 1 of the beginning of the pelvic floor direct treatment.